after being diagnosed with cancer. I'm sure many of you are often asked, how are you doing? I'm actually sure many of you get that asked all the time. Now, most of you probably answer politely saying that you have your good days and your bad days, but that you're getting through it. But sometimes I'm sure that deep down, you actually just want to answer, cancer sucks. Now, while these check-ins are meant to be supportive, many patients have told me that it becomes frustrating, tiring, or sometimes outright annoying to have to answer those questions over and over again. Now, but have you ever noticed that while all these people are asking you how you're doing, are many of them asking how your partner is doing? Probably not. When it comes to cancer, typically most of the support and attention is offered to the patient, and the partner often gets neglected. Now, of course, it makes sense for everyone is worried about the patient and wanting to provide support just to the patients. But unfortunately, research has shown that partners experience as much, if not more, distress than patients themselves. Now, this may come as a bit of a surprise, but just take a second to think about it. While patients are getting treatment, the partners generally have to be supportive, work, take care of things at home, or maybe take care of children or new household responsibilities, all the while trying to be this beacon of strength for you, maintaining a positive outlook and really trying to hold back tears or anger and frustration. They're trying to just be rock solid. So, and throughout all of this, they also are watching you go through your cancer treatment, and sometimes partners are having to watch awful side effects. And they can't do anything to protect the patient or anything else to fight the cancer. Over time, all of this can take its toll on partners. And the next thing you know, partners are experiencing clinically significant levels of distress. But they often try not to show it and end up coping alone. And the reality for partners of individuals with cancer is that cancer sucks. But they rarely get asked, and they rarely get offered or ask for support. So here's a few tips for patients to better support partners so that together you can support one another and cope with cancer and as effectively as possible. So first off, I recommend check in with your partner and ask how they're coping with your cancer and its side effects. Try starting off the conversation by acknowledging that your cancer has impacted both you and your partner. Perhaps try saying, I know that we've both been affected by my cancer. Next, ask how your partner is doing. So maybe ask, how have you been coping? Just by asking this simple question, you are opening the door to supporting one another and allowing your partner to discuss their feelings with you openly and honestly. Secondly, encourage your partner to do things on their own or with friends so that they focus on their own self-care. Now, while this may be difficult to plan for logistically, it is really important that partners have breaks to recharge and be steady for the long haul. Lastly, recommend that your partner get support if they're experiencing symptoms of distress. Now, while most of what you read on the internet or in clinic may focus on really only supporting the patients, just know that there is plenty of support services out there for partners in too. So keep these tips in mind to support your partner so that you can support each other throughout your cancer journey. For more tips on how to support your partner or to schedule an individual or couples online psychotherapy session, please feel free to check out my website or schedule online at www.psychotherapywithoutborders.com. Cancer sucks, but you and your partner can cope with cancer together to have a full life.